This is Dr. Bryan Weinstein. I'm a board certified clinical psychiatrist. I've been practicing for over 25 years. I founded and direct Summit Psychiatric Services, which is now primarily a telepsychiatry company. But I want to talk about the topic of depression. Many times, we hear, I'm depressed or I'm feeling depressed, things of that nature. Depression, of course, is considered, in the clinical arena to licensed practitioners. Depression means more than just a state of mind or, being sad. Depression is so much more. It's an actual clinical event, a distortion in the mind due to biochemical changes. Depression has been termed, appears in different terms, such as major depressive disorder, persistent depression or recurrent depression, depressive psychosis, where a person's not only depressed but can, lose touch with reality, catatonic depression. There is perinatal depression, which is depression associated with pregnancy, seasonal depression or seasonal affective disorder, where people become depressed based on lack of sunlight, and again, it's seasonal. And of course, people talk about situational depression, which is really adjustment disorder with depressed mood, and that's based again on a certain situational event. Depression, clinical depression occurs in approximately 6 to 12% of our population. We see it, the highest rates of depression is seen usually in women between the ages of 40 and 59 years old. Lowest rates of depression are seen among teenage boys and men over age 60. But, again, it's a psychiatric illness. It's a clinical event. It's usually due to a combination of genetics, as well as, one's environment. Some, studies show that 40% of people with depression can trace that to some type of genetic link, and environmentally, that makes up the other 60%. So it's primarily an environmental vector as well as a genetic link. So people with tough backgrounds, unhealthy environments, again, perinatal events, prenatal events, such as smoking, alcohol, things of that nature, and again, genetics can make up depressive states. There could be endocrine issues. Cortisol and amygdala are usually associated with depressive events as well. So what is major depression? What is major depressive disorder? Well, it's a combination of many symptoms. You have to be depressed, so your mood has to display either sadness or profound irritability. You have to show usually symptoms need to be like 5 out of 7 symptoms need to exist. And again, these would include diminished interest. We call this anhedonia. Lack of pleasure, lack of desire to do things, almost all activities. There has to be either significant weight loss or weight gain is associated with depression. Insomnia or hypersomnia is seen nearly every day. People having trouble getting asleep or falling asleep, things of that nature, or sleeping too much, excessive sedation. Restlessness, psychomotor agitation, or retardation, meaning the body just slows down or is amped up, is restless. You can have extreme fatigue or loss of energy that is seen in depressive disorder. Worthlessness is seen, or excessive or inappropriate guilt can occur for people with depressive states. So your mind, the way you think, your thought patterns, feelings of worthlessness, hopelessness, inappropriate guilt. So the mind starts playing tricks on you, if you will, when you're in a depressive state. You can also have a diminished ability to think, concentrate, focus. And again, you can experience suicidal thoughts and, of course, suicidal ideation um, can occur. And, suicidality is, of course, a significant factor in mortality and morbidity with depression. So, depression usually causes marked impairment in social and occupational functioning, and it's a real event. And these symptoms have to last at least for 2 weeks straight. So what do we do about it? Well, the treatment for depression is a combination of medications, psychopharmacology, as well as psychotherapy. Those are the two primary focus for treating depressive states. And one needs to see a psychiatrist and or a psychiatrist and psychologist, therapist to work on this. And usually there's excellent outcomes. The medications that are out there for depression do very, very well. There's other procedures that can be done for people who have resistant depression, such as ECT. There's ketamine. We're showing that ketamine is a nice way of treating resistant depression. So things of that nature. I can talk about resistant depression in another talk. But garden variety major depressive disorder, again, very strong clinical event. People are in marked distress and do need the care of a psychiatrist and or psychologist or therapist. So I hope that this is good information. And of course, if anybody experiences depressive states, please reach out for care. Thank you.